In other news, there's no question the mental health needs of young people are growing. It's prompting new ways of delivering care right here in Windsor, Essex. From in-home visits to on-the-ground crisis response, Hotel-Dieu Grace Healthcare is at the center of much of that work. CTV's Travis Fortnum is there with how that care is evolving. Travis.
Yeah, Stephanie, this is effectively a rebrand and expansion of services that the team at Hotel-Dieu Grace Healthcare has been offering for a few months now. An expansion, they say, that brings their response services for children more in line with what is offered for adults. And they say that speaks to evolving need among children. The numbers are staggering. 1 in 4 youth in Canada have been diagnosed with a mental illness, according to the Public Health Agency of Canada, and nearly half of all mental health disorders begin before the age of 18. At Windsor's Regional Children's Centre, those national statistics are playing out locally, with higher demand and more complex cases.
People aren't coming in as often with straightforward, my mood's not feeling so well, or I'm feeling anxious. Now it's a lot of, I have a significant history of trauma, and I feel anxious, and I don't want to go to school, and there might be tension in the home.
Evolving demand calls for evolving response. So the RCC is renaming and expanding its intensive outreach program, now called the Assertive Community Treatment Team for Children, or ACT-C.
Assertive community treatment is a model that's been around for years and years in the adult mental health system, and we're going to be bringing it for the first time to serve kids as young as 6 years old.
The approach is flexible and focused on meeting families where they are, often in their own homes.
We can see families as often as each day, Monday to Friday, in their home if that's what their care requires.
And it's not the only change in mental health support Hotel-Dieu Grace Healthcare has had a hand in over the past year. A program that pairs Windsor Regional Police with social workers is showing results, reducing the number of people being sent to the ER in crisis.
90% of these interactions did not result in an emergency department visit. So that's always the goal, is to assess risk and safety and then link people to the appropriate resources.
The crisis response team has handled about 1,200 calls since launching last spring, offering assessments and diversion to community care instead of hospitals. Meanwhile, back at the RCC, McNeil says ACT-C has helped more than 50 local families.
We've had families where the child was excluded from school, so they weren't able to attend anymore. Over a span of about 4 or 5 months of seeing them every day, Monday to Friday, the kid could rejoin the classroom and have success at school.
The RCC says the model is working and hopes to expand it even further as demand grows. And McNeil says families who think they have a child who might benefit from this service need only give them a call. I will put their phone number in our web story, which you can find over at ctvnewswindsor.ca. Stephanie.
Thank you, Travis. Travis Fortnum on a program, again, deemed much needed in our community.